It cures when everything fails. It was said by actually Hippocrates. In the old time when there was no antibiotic, there was no any good surgical skill. At that time one of the most common healer was heat. Heat was used most of the time for the abscess, for the fistula, for the different type of injuries. Once the Edison had invented the electric bulb, a specially designed electric bulb was used. There was one projection, that is a complete tubular projection through the bulb, and it was used actually to introduce into the anus so that the fistula or the piles will be treated. And at that type of prolapse also, mucosal prolapse, an entire mucosa burns, and after that it will create a stricture and the mucosal prolapse will be corrected. So heat is used for a long time for this type of treatment. Still today also we use seizures or the platelet. But the electrosurgery is the first mode of dissection in laparoscopy. Blunt dissection also we do by the platelet and instrument, and sharp dissection we do by the knife or by the seizures, because it can lead to a lot of bleeding, and in laparoscopy we want to achieve hemostasis before dissection. So altogether, electrosurgery is the most convenient way of dissection in minimal access surgery, but unfortunately it is the most risky method of dissection also. The complication rate due to the use of electrosurgery is 1 to 2%. In 1 to 2% of the patient, they get complication, and there may be sometime the different organ injury, remote injury, collateral damage, and so on. Now, that's why in this presentation we will discuss all the complications which is possible and how to get rid of that and which type of energy sources should be properly used. Before going in detail of the electrosurgical dissection, we should just try to recall some of the principles of electricity that already you know. Current means flow of electron. Circuit means pathway of flow of electron. Voltage means force that cause electron to flow. High voltage means more force of electron. And resistance means obstacle to the flow of electron. This is simple physics, everybody knows. There are two terms which is used in electrosurgical dissection. One is electrocautery, another is electrosurgery. This term electrocautery which we use actually, it is wrong term, which is not correct. Electrocautery was the machine which was used in old time by the gynecologist for cervical ablation or by the skin specialist for the condylomata or skin tag. It was a small box, and there was wire attached, and there was a heated platinum loop. So once you will switch on the cautery machine, the tip of the instrument will get red hot, and then if you will touch something, it burns. That was cautery. It was essentially an application of direct current, DC. It is not alternating current. And there is a high resistance metallic conductor, and due to flow of the current, that metallic conductor will become red hot, and then you will burn the tissue. That was cautery. The machine which we use today is not a cautery machine. It is a wrong term which we use as a synonym. Actually, it is an electrosurgical generator, and it is a high frequency alternating current. Tip of our instrument is not heated at all. There is no heat. Once the electron jumps to one medium to another medium, due to turbulence of ion inside the cell, heat is produced. And once the tissue is hot, that's why instrument is getting heated. So always the temperature of the instrument is less than the tissue. So it is reverse. In electrocautery, heat of the tissue, heat of the instrument is passed to the tissue. And in electrosurgery, heat of the tissue is passed to the instrument. Instrument is cold. Instrument is only getting little heat because tissue is heated. And how tissue get heated? Because it is alternating current. What is alternating current? And what is direct current? In direct current, positive and negative is fixed. Just like your battery. One is positive, other is negative. Isn't it? And in alternating current, which is in our household supply, is alternating current. In alternating current, positive and negative is not fixed. It is changing every second 50 to 60 times. Positive becomes negative, negative becomes positive. Current is traveling in either direction, that is alternating current. And due to that high frequency alternating current, once the current will go inside the cell, there is a turbulence of ion inside the cell. Turbulence means uncontrolled movement. And due to that turbulence of ion inside the cell, the temperature of the cell will increase. And altogether many cells makes the tissue temperature increases. And that heat once come to the instrument is getting heated. It is just like one example you can understand, the difference is just like the gas welding and electric welding. If any one of you have chance to see the fabricator, how they work, they have two type of welding machine. One is called gas welding. In gas welding there is a flame. Gas is coming and there is a flame. And with the flame they melt something and then it will join. Like for aluminium, for soft metal they use gas welding. And other type of welding is electric welding. Sometimes if your car needs denting, or sometimes your silencer is broken, or they come to your house to put the grill or fabrication, they use electric welding. How electric welding is done? That one earthing will be applied, and then with one electrode, as soon as they touch the metal, a lot of spark is created. There is no flame. The instrument which they use for electric welding is cold. But once the current jumps from one medium to another, a lot of spark is produced, that is called as turbulence of ion, and that creates the heat locally produced at the point where it touches, and then metal is getting welding. So electrosurgery is like electric welding, and electrocautery, that is like a gas welding. This is a typical diagram of laparoscopic electrosurgical generator, monopolar. This is the generator. The current comes to the one wire, and you will attach to any instrument you like. You can attach to the hook, you can attach to the spatula, you can attach to the Maryland, you can attach to the scissors, you can attach to the tritone, you can attach to the aspiration needle, any instrument. And then you will touch the body of the patient or the tissue which you want to work. And then current will start traveling through the body of the patient, and then it will go to the patient return plate. And from the patient return plate, it will return back to the generator. It will return back to the generator. This is a typical circuit of the monopolar. Now, there is one problem, that if there is any alternative pathway is present, current will try to return from that also. Like suppose patient table is not properly insulated, and if the thigh of the patient is touching the patient table, or if the arm is touching the armrest, or if the fingers or anywhere it is touching, then current will try to return to the earth from these contact points, and patient may get burned. Sometimes if patient has not removed all the ornaments, like patient is wearing the nose ring or ear ring or the finger rings, and if it is touching some of the uninsulated part of the metal or saline stand or headrest metal part, then these metal will make a contact with the metal of the surrounding equipments, and current will start traveling through these metal parts and finger of the patient will burn. So all the ornaments has to be removed. If you cannot remove some of them, you can put some sponge and you can apply a bandage so that at least it should not touch anywhere uninsulated part of the OT table or any of the other equipment. Sometimes even the pulse oximeter, cardiac monitor, these instruments are applied, and if their wires are broken and if it is touching some of the other metal, current will start traveling from that also, and your patient may get burned where those equipments were attached. So this is a big problem of the monopolar. So proper insulation is required. Now question is, if it is that much risky, why we are using and how much safe it is, and which frequency is safe. If you want to use any of the electrosurgical generator, safe frequency is 500 kHz to 33 MHz. What is Hertz? Yes, that is frequency. What is the frequency supply in your household? 50 to 60. 50 to 60. All over world. Voltage may vary. In USA they use 110 volt. In India we are using 220 volt. But frequency is everywhere same, 50 to 60. Do you know why? Because at that frequency our muscle and nerve is maximally stimulated. So accidentally, if you will touch somewhere, suppose this mic has a current and I am touching, I will get shocked and I can protect myself because I will shout, and involuntarily my group of muscle will contract and I will be thrown away or I will pull my hand. Because at 50 to 60 Hz frequency, muscle and nerve is maximally stimulated, and that is a safe thing. Why maximally it is stimulated? If you remember your MBBS second year physiology class, then you might have in the mind that for any electric conduction to the muscle and nerve, there should be action potential. And what is action potential? That through the cell membrane, if potassium comes out and chloride enters, then the permeability of the ion through the cell membrane creates the action potential to generate. And then that positive and negative transfer from the cell membrane from one cell to another. And this is the way how electric conduction is traveling through the nerve or through the group of muscles. Is it clear? Is it true? This is true. Now what happens at 50 to 60 Hertz, alternating current, it is not a direct current, alternating current. In that alternating current, once the outside of the cell membrane is positive, it will pull the chloride and push the potassium. Again it is negative, push the potassium and pull the chloride, and vice versa. So there is a rapid permeability of the ion through the cell membrane, and that creates the mass burst of the action potential. And that is called as electric shock. Due to that complete explosion burst of the action potential, due to the frequency, our entire body will get shocked. That is called as electric shock. Your brain completely gets excited, exhausted, completely you will feel like dying at that time. That is electric shock. Sometime when you get, you might have felt it sometime in your life. That is electric shock. If frequency is increased to 100 kilohertz, there is no electric shock. Muscle and nerve stimulation ceases. Why? Reason is 100 kilohertz means 1 lakh hertz, means 100,000 hertz. At 100,000 hertz, frequency is so fast, so high, so rapid that the net permeability of the ion through the cell membrane is 0. Because once the outside is positive and chloride started moving, as soon as it started, this positive is again negative. And then it again started going in, again it is positive. So the ions are confused. That I don't know what is the command. Just like if I will hold the arm of someone and I will do like that, he will just vibrate. He cannot go this side or that side. Because I am pulling, and by the time he moves, I push again. So net result of his movement is 0. And he is just vibrating. That is called as turbulence, uncontrolled movement. Because frequency is changing so fast that immediately positive is negative, negative is positive, so there is no permeability of the ion through the cell membrane, so there is no action potential, and there is no contraction of the muscle, and there is no electric shock. If you will go to the 500 kilohertz to 33 megahertz, if it is completely nice and absolutely safe, your patient will not get shock, only the tissue will get heated due to the frequency. And once the frequency is 500 kilohertz to 33 megahertz, this is called as safe electrode frequency. This is a big frequency range, 500 to 33. Most of the time, 500 kilohertz to 10 megahertz frequency generator is called as simple electrosurgical generator. 10 to 20 megahertz frequency sometimes is radio frequency generator, and 20 to 30 megahertz frequency is usually used in plasma kinetic generator. Higher the frequency, better is your machine. And less wattage of the current you need to work. Just like if you have to give the incision on the skin. Sharper is your knife, less force you have to apply to cut. Isn't it? If your knife is blunt, suppose already with that knife you have performed 2-3 surgery, then will it cut the skin? It will not. And if you want to cut, you have to press hard, you have to rub over the skin 2-3 times, then it will cut. Exactly same way, higher the frequency you will buy, less wattage of the current is required. And less the frequency you will buy, high wattage of the current is required. So always keep in mind that when you buy any electrosurgical generator, this is your right to know that company is selling which frequency to you. If you will buy from 500 kilohertz, it will cost you approximately 50,000 rupees. If you buy in megahertz, it will cost you 4-5 lakh rupees. And if you buy plasma kinetic, it will cost you 12 to 15 lakh rupees. What is the advantage of buying the more higher frequency? Low wattage, less current is used. And with less wattage, like suppose, if you are using simple electrosurgical generator for using the PCOD or salpingotomy or colpotomy, if you are using simple generator, it may need 40 to 60 watt. If you are using radio frequency generator, it will take only 20 to 30 watt. And if you are using plasma kinetic generator, it will take 5 to 10 watt. And less watt means less injury and better effect. Sometimes some Chinese or some Indian machine, they have some unfiltered low frequency. Machine has less than 500 kilohertz. And in 100%, 2% frequency is 50 to 60 hertz. Cost is 15,000 rupees. You are very happy that it's a good buy. You will buy the machine and you perform surgery. During surgery, patient, you will see the tear is coming. With every application of the paddle, patient is getting shock. And it is a cruelty. Patient body is paralyzed, otherwise he would have been slapped you. But patient's muscles are paralyzed. You know, anesthesia can only remove the pain if you have good analgesic effect. Like nitrous has analgesia also. But any of the analgesia cannot remove the shock. It is another story that at the end of the surgery, patient doesn't remember what happened during anesthesia, but he has suffered. He has faced this cruelty. That period of time he was tortured, and this is medico-legal issue. If patient remember the torture during the surgery, and if he will complain in the court that during entire course of surgery, I felt pain and I can remember what the surgeons were talking about. This is a medico-legal issue. And especially electric shock is just like punishment, and this should not happen. So always buy a good frequency electrosurgical generator. Don't go for cheaper quality machine. Burn is equal to intensity of the current into time by area. This is the equation of electrosurgery. Burn is equal to intensity of the current. If you will see, there are two types of machine available in the market. One is 250 watt and another is 400 watt. If you want to do the simple laparoscopic cholecystectomy, hysterectomy, then 250 watt machine is sufficient. And if you want to do the operative hysteroscopy or TURP, then 250 watt will not work. You need 400 watt machine. Because in TURP or hysteroscopic myomectomy, you have to work underwater. And underwater, intensity of the current is required is more. And that's why 400 watt current is used. Now suppose 250 watt current is there. If good machine you have, it will write 20 watt, 30 watt digitally. If it is a little inferior machine, then it doesn't write it there digitally. It has a knob, 1, 2, 3, 4, 5, 6, 10. If you are putting it to 1 and your machine is 250 watt, then 1 means how much? 25. 2 means 50. 5 means 125 and 10 means 250. If your machine is 400 watt and if you are setting it to 1, that means 40 watt. And if you will put to 5, that means 200 watt. Isn't it? More the intensity you will give, more burn will be there. Less intensity you will keep, less burn will be there. Because wattage of the current will be less. Less intensity means less number of electrons. Means less current. And less current means less burn. Another variable is time. So, intensity of a current is directly proportional. Another variable is time. Time means more your paddle application time will be exposure, then there will be more burn. Like if you are holding a fallopian tube and you press stop, then it will less burn. And you hold you are keeping pressing, standing over the paddle, then everything will start burning and smoke will start coming out. There will be more burn. More time, more burn. Just like if you are making an omelette and if you will not turn the side, then the entire omelette in the stove will burn. Breads are burning every day because time is not controlled. But area is inversely proportional. And area is the main culprit. Most of the complication of the laparoscopic surgery in the monopolar current happens due to the wrong area. How I will say? This is right and left hepatic duct. And this is CVD. Now here you have cystic artery, which is a branch of right hepatic artery, which was going like that. Suddenly, bleeding started. Why it started? Because you didn't skeletonize it, a lot of fat was still there, a lot of peritoneum was still there. And you were trying to clip and cut, and it was not recognized, bleeding started. Now you have only option, you are having the Maryland, you will bring the Maryland and you will hold the bleeder. And you will hold the bleeder and you will cook it. And once you cook, the here bleeding stops. And you are happy, now problem is solved. After a couple of weeks, up to 3 months also, patient returns back again and patient has jaundice. You will say that no, I have removed your gallbladder. You know jaundice happens due to the gallstone. Sorry, CVD stone or for cerebral problem. So you should go somewhere, you send it for ERCP. In the ERCP they will put one stent. And here this stent will go like, and then it will be corrected. Otherwise, it may be complete obstruction. And here will be the stricture. This is the point where the stricture will be there. And the patient will get complete stricture of this area. Here it will be stricture. And now the only thing what you can do is the patient is hepatojejunous. This is not a new pathology for the patient. This is first surgeon's mistake. This is our mistake. When we have applied a bunch of tissue, then always there is remote injury. Why this injury happens? Because if you will see very carefully, here is suppose this is the lever. All the electron which you have applied to this area first has to go to the CBD. From CBD it will go to the common hepatic duct. From common hepatic duct it will go to the liver. From liver it will go to the latissimus dorsi. Then it will go to the quadratus lumborum. Then it will go to the buttock psoas muscle, and then it returns back to the machine. In this entire pathway of circuit, heat will be maximum where area is minimum. And while passing through this narrow area, this area gets heated and it gets burned. At that time nothing will happen. After a couple of weeks, due to the fibrosis, stricture starts, and then CBD obstruction starts. This is called as remote injury. Another story, let us see for the gynae case. In gynae case, let me make it white. You are performing hysterectomy. Suppose this is uterus and here is the bladder, and then here is the uterine artery. All the colors are coming. Here is the uterine artery coming, and which gives you the ascending uterine, and then the cervical branch, and then it comes like that. This is the uterine artery. Now here is the ureter which is going to the bladder, and uterine artery is crossing the ureter like this. Now you are cooking at that area with the bipolar, and suddenly after bipolar you cooked and you cut. Once you will cut, due to any reason that person could not be sealed properly, and there was huge amount of the bleeding, and the blood is vein and artery both are bleeding, a lot of bleeding started. Now you will take the one Caesar, one Maryland, and you are going and cooking. Now what happens? Ureter has a very high concentration of normal saline. All the electron ureter will jump over the ureter. And ureter will tell, come, I will take you where you want to go. And all the electrons through the ureter will go to the kidney, from kidney it will go to the psoas, from psoas it will again go to the patient return plate, and patient return plate will return to the, again in the machine. Now in this, suddenly the peristalsis of ureter started. And at that time, due to the shrinkage of the ureter of this area, due to peristalsis, ureter is shrinking here. And suddenly this area burns. And after a couple of weeks, patient comes with the hydronephrosis and pain in the kidney area. And you will ask the patient what is the problem. Patient will tell that I have the pain, and you will get the ultrasound and hydronephrosis. You will send the patient to the urologist. That this is not my problem. Urologist, if he can put one stent through the bladder and he will leave it for a couple of weeks, then it may get cured. Otherwise, only thing is ureteric anastomosis or neo-ureteric implantation into the bladder. You know the incidence of ureteric injury in the total laparoscopic hysterectomy is 4.3%. And most of those injury happens due to the electrosurgery. And this is called as remote injury. Remote injury happens where the area is narrowest. Suppose something goes in this building and everyone, you are in the room, every one of you want to escape out of this room. Where will be the maximum resistance? On the door. Because everybody wants to go and door is narrow. So maximum heat will be in the door and resistance will be there. Fight will start. Some people may fall, some people may injured. Exactly same way in the pathway of the circuit. Why this bulb is lighting? Why not all the wire of this building where the electrical supply is there, why it doesn't burn? Because the area of the diameter of the filament, the wire inside the bulb is thin. That is called as bottleneck effect. And once the electron wants to flow to that part, it gives you resistance. Resistance means obstacle to the flow of electron. And if there is obstacle to the flow of electron, there will be heat production. So heat is maximum where area is narrow. And that's why this is remote injury. So question is, how to control it? Tell me, how you will control the problem of remote injury with the monopolar? There are three methods. If you will keep in mind, monopolar remote injury will not happen. Anybody?
Make sure that the minimum area is at the...
Excellent. You know, answer is hidden in the equation. Equation is 1 is equal to intensity of the current into time by area. So what you do, you will not hold that much big. When you have to hold, I will not hold that much big area. I will not hold this. What I will do, if the uterine was bleeding, I will hold only the precise bleeder point. And if I have to burn, I will burn only this small area like this. If myself I will hold the small area, where will be the maximum heat? Where I am holding. Isn't it? Where I am touching. And that area will burn because this is the narrow area. If you are holding a bunch of tissue, then remain ready for the injury somewhere else. Just like in your household supply, in every house there is a main switch. And in main switch there is a fuse. And in the fuse there is a thin wire. Why you are putting a thin wire? Because if there is any malfunction, any electric shock anywhere, this fuse should blow. If your fuse is repeatedly blowing, you will make a big wire, metal, and you will put it, I can see now how this fuse is blowing. And you put it, your fuse will not blow, entire house will fire. Exactly same way, if you are holding a big bunch of tissue, if bleeding is there, you will say, okay, I will see how you are bleeding, I will control you. And hold everywhere, here and here, you are burning, then you are firing somewhere else. After 2 days, patient may come with the perforation, may come with the stricture. That is called as remote injury. So first way, how to control? We should apply the minimum amount of tissue at one time at the tip of the instrument. Second way is, your wattage should be minimum. You know, you should not burn the tissue, you should cook the tissue. When you go to your kitchen, and if you see the black smoke, that means something is burning. And if you see white smoke, that means it is cooking, it is vapor. Isn't it? If white vapors are coming, you are happy, everything is cooking. But if somewhere black comes, that means it is burning. Inside the abdomen, in electrosurgery, you are not supposed to burn the tissue. You have to cook the tissue. So use less wattage of current. How much wattage of the current is required for which surgery, we will give you a list. But ideally, if you are using a simple electrosurgical generator of cheaper quality also, then ideally only 20 to 80 watt of the current is used in laparoscopy. More than 80 watt is dangerous. That means you will land up in some complications somewhere. This is second method, that I will use minimum power. We are not inside the abdomen to celebrate the firecracker. We are to achieve hemostasis. Third way, intermittent. Intermittent means stop plus open, stop open, stop open. You should not hold it, everything burn, break, complete, black. Then there will be remote injury. Stop. Open the jaw. Why open the jaw? It should not get a stick there. Again open the jaw, again catch. Stop. More than 3 seconds in one go should not be pressed. If you will press more than 3 seconds in one go, then tissue burns. Just like if you are making an omelette or if you are making a bread, you are time to time you are changing the side. And more hot your vessel is there, more frequently you have to change. Isn't it? Suppose you are pressing the cloth. Pressing your dress means ironing, and it is polyester, but iron is too hot, it will burn. If you don't want to burn, is there any way? There is a way. You do it faster. If you keep it and talk to someone, what will happen? It will burn. So if you will control the time, the burn will be less. But suppose the same ironing press is too less hot, means it is too cold, and you have to press your jeans pant, then what you are doing, holding it, pressing in, and slowly you are moving it, because heat is less. So you need more time for that heat to transfer to your cloth. So the first way is hold the minimum amount of tissue at one time. Second way, you hold the minimum intensity of the current at one time. And third, you do the intermittent activation. Intermittent means stop, open, stop, open. And when you are removing it, surrounding cold tissue will make your tissue colder. And that way you can minimize the remote injury. Remote injury is one of the big problems in electrosurgery. Like here you can see, the gynecologist is doing the salpingectomy. This is fallopian tube with a hook trying to cut it. But unfortunately, the more surface area of the hook was not only touching the tube, it was touching the uterus also, because of the wrong port position and bad technique. Now it is not burning here, it is burning the bowel here.
It's transmitting?
Fimbrial end of the tube was touching the bowel, and a small contact area was there. One spark will happen because of the narrow area, and then after 2 days the patient will come with the peritonitis. You will swear that I swear I don't touch any bowel, I did only tube. But of course you have not touched, your current has touched it. And that is called as remote injury. Remote injury can happen anywhere. You are performing surgery in the gallbladder and the intestine can burn. And if you are performing surgery of the uterus, and the ureter can burn anywhere. Sigmoid colon can perforate. The small intestine can perforate. Appendix can burn. That is remote injury. Just like if I am short circuiting here, fuse is burning in the main fuse there, because area is narrow. In entire circuit of the pathway, burn will be maximum anywhere if the area is narrow. Here this is cholecystectomy, this entire CVT is burning. Sometimes patient thigh burns, patient arms burns, patient finger burns, patient neck burns if the necklaces are there. And if those necklaces are touching the patient table. When you are attaching the patient return electrode, you have to be careful. Patient return electrode, when you attach, you should attach to the well vascularized muscle mass. Like we should apply to the buttock, we should apply to the thigh, we should apply to the calf. We should not apply to the area patient return plate, area where there is a vascular insufficiency, like palm, sole, hair, scalp, we cannot apply. You should avoid the irregular body contour. Sometimes when you are doing vaginal part of hysterectomy, buttock of your patient was not up to the edge of the table, and there was a patient return plate which you have applied here. And then your patient buttock was not up to the edge of the table, you will ask your assistant to pull it. And suddenly this patient return plate has displaced in the halosacral curve. Now that narrow area is coming into the contact, and immediately that area will burn. This is silicone type of patient return plate, which is better. You know why? Because even if you put the irregular body contour, it can fold. And if you want the best, this is adhesive type of patient return plate. Adhesive type of patient return plate has an advantage. Here, this is a very nice adhesive is there. Advantage that there is no any area, there is no any danger that it will create detachment. Here 100 square centimeter area is there. This is 100 square centimeter. 2 silver foils are there. And you can stick anywhere, like this can be stick. It is completely adhesive here.
Why two, not one?
Pardon?
Why is two area rather than?
You know, because it takes the impedance and senses the current in between both the limbs. And then you can stick anywhere in the arm or in the biceps or in the calf muscle like this. And there is no chance that it will, even if the patient moves, it cannot be detached. Only problem of this one is that it is single use. And it will, hair will be just like how you do waxing. If you stick, all the hair comes out. Isn't it? So, when you are using, you should try to see the incision site also. Suppose you are doing surgery of axilla, then you should apply over the biceps. You should not apply to the calf. Here you can see that one orthopedic surgeon has applied this patient return plate on the medial condyle of the bony prominence. And bony prominence has a problem that it doesn't allow the surrounding floppy muscle mass to come into the contact with the patient return plate. Bony prominence will give you a narrow area and will not allow the surrounding floppy muscle mass to come into the contact, and then it will burn. So this also must be taken care of. Here also this is the burn due to the patient return plate. If this is electrode and this is patient return plate, if your patient return plate is small, less than 100 square centimeter, 100 square centimeter is not a big area. 100 square centimeter means 10 by 10 centimeter. Of this palm, this is 100 square centimeter, that much. 10 centimeter, 10 centimeter. 100 square centimeter. It is 1/4 of this. That much is 100 square centimeter. At least that much area must be in the contact. 10 by 10 centimeter. If it is less than that, heat will be produced both the places where you are touching and where your penetration plate is there, and your patient will get burned. But if you have a big penetration plate, heat will be not produced here, and it will be only where you want. And that way you can prevent the remote injury. So, to prevent the remote injury, proper application of the penetration plate should be there. There should be less power used, less amount of tissue should be held at one time, and intermittent activation is required. If you will keep in mind, then there will be no remote injury. Bipolar doesn't have these problems. Why? The scientists, they have seen that when they were bringing the patient return plate very near to the target of dissection, then remote injury was not there. So they thought, why not to bring the patient return plate inside the body of the patient? Yes, to the target area. So when you switch the machine to the bipolar, there is no need of attaching the patient return plate. Even if the patient return plate is attached, it gets disconnected. And that is called as bipolar.
Automatically disconnected.
Automatically disconnected. In bipolar, patient return plate disconnected, and same wire comes to the one of the pole. So in bipolar, positive and negative both is inside the body of the patient. Some people, they say that bipolar behaves like a married couple and monopolar behaves like an unfaithful bachelor. Where they can deviate wherever there is area of least resistance. But in the bipolar, positive is taking care of negative, and negative is taking care of positive. Electron only goes in between those poles. It cannot deviate anywhere at a wrong place. So bipolar doesn't have problem of remote injury. Even if you hold more amount of the tissue at one time, no problem. Even if you give more timing, no problem. At least remote injury is not a problem. And even if you increase more intensity of the current, no remote. Remote injury is not possible as long as positive and negative is nearer to each other. If your wife always 24 hours remain with you, then you don't have any chance to do anything wrong. So this is safe. But it has some other drawback. The drawback is that it has more collateral damage, it doesn't cut, and it has to be especially designed. Now come to the point. Suppose you are performing a surgery and you have a tissue like here is a tissue and you are using bipolar. This is one pole, this is another pole. And then you cook it. When you cook it, you have collateral injury. That is called as collateral damage. If you will see just near where you have these two jaws, in between the temperature is approximately 300 degrees centigrade. Approximately 3 millimeter later, it is 100 degrees centigrade. And approximately 6 millimeter lateral, it is 55 degrees centigrade. So, if you will use 100 watt of current for 3 seconds, then there will be approximately 6 millimeter burn. Collateral injury. If you will use 100 watt of current for 3 seconds, then there will be 6 millimeter burn. Why? Collateral injury we should not confuse with the remote injury. Collateral injury is due to the lateral spread of heat. Just like if you make a candle flame and you take a pin in your hand and you put one end of the pin to the flame, immediately you will not get any burn in your finger. But after a couple of seconds you will try to drop it because your finger started burning. Isn't it? That is calling collateral injury, means spreading from one cell to another cell to another cell. This is collateral injury.
What's the difference between collateral and remote?
Remote injury will happen anywhere else, which cannot be seen.
On the transmission from the cells or?
Pardon?
For the remote heating.
Remote injury happens due to the current.
Transmission.
And collateral injury happens due to the lateral spread of heat. It is not due to current. Isn't it? So, for same wattage of the current, collateral damage is more. Why it is more? Because positive and negative, remember what I am telling you. For same wattage of current, for same wattage of the current, 100 watt of the current, if you use for 3 seconds, collateral injury will be 6 millimeter. And if you will use a monopolar, suppose there is a monopolar, then it will be only 3 millimeter. Collateral injury will be that much only. Now why? Because here positive and negative is so near that electron produce more heat. Just like husband and wife, they fight more. Because exchange of the ideas are very quick. Suppose in the morning, if the wife is giving breakfast to the husband, he will say that it is not good. You know, this breakfast even a dog cannot eat. Then the wife will tell, you will not like anything I will make. You don't like anything of mine. And then fight starts. You rarely fight with your friend. Reason is, one pole is here, other pole is here. Other pole is here. Now what happens? By the time this electron reaches there, the intensity gets slow and heat is not there. Just like your relative who is distant from you, generally there is no time to fight. So collateral damage is more in bipolar for same wattage of current, but then also it is good. Why it is good? That collateral damage I can control. How I will control? if I know that I have to use bipolar, instead of this 100 watt, I will use only 10 watt. Isn't it? And instead of this 3 seconds, I will use 1 second. And then I can, means I will open and close the jaw intermittently. If you don't want to fight with your spouse, then make it two habits in your life. One, keep the intensity of your voice low. And another, keep it intermittent. Like suppose if she don't make the breakfast of your choice, instead of what you are making this nonsense food nobody can eat, you should tell that if you think you can make and you can improve this food, intensity low. And if she says that even though after that you will not like anything of mine, don't speak at that time. Intermittent, after few times you can say, okay, whenever you have time, just think about that what I have told you. Then there will be no fight. If intensity will be low, and if your conversation will be intermittent, guarantee there is no fight. There is no heat production. There is no heat production. So, bipolar has less collateral damage. That's why neurosurgeons they use. Why? If you want to minimize the collateral damage, I will decrease the intensity and I will do ting, stop. Ting, stop. And they can burn and put some fluid also they have put. And they can burn one specific nucleus of the brain also. So bipolar, for same wattage of current, bipolar has more collateral injury. But collateral injury can be controlled because it is visible. It is in front of you, you are seeing. When the husband and wife they fight, all the neighbors they know that now time is approaching, their fight is going to start now. And they listen today what is going on. Because everybody knows, remote injury you will not see, you will know only when the complication happens. If complication doesn't happen, nobody knows. You are happy, you are gentleman, you are the best person. But once the complication happens, your relationship has been exposed, then oh no, he was doing like this. Exactly same way, remote injury, 90% of the remote injury is compensated. The body itself controls. If you get a little bit burned, okay, let it burn, tissue will heal and it is okay, unnoticed. And only it comes to know once complication happens. Like fistula develops, perforation happens, a stricture started, then only it will come to know. But here, collateral injury, it is visible in front. There is nothing to hide in the collateral injury. So it can be controlled. Remote injury, why it cannot be controlled? Because I am not seeing where it is happening. And you will know only if the complication happens. So this is the difference between the monopolar and bipolar. And collateral injury of the bipolar can be minimized by keeping a very low wattage of the current and more intermittent. So altogether collateral injury can be less. But for same wattage of the current it is little more because electrodes are too nearer and rapid exchange of the heat and electron in between the ions creates more collateral injury. So this is the difference between the... Now, first problem of the bipolar is for same wattage of the current more collateral injury. Second drawback is it doesn't cut. If you will try to cut, you have to first cook it and then cut with the scissors. Third problem is every instrument cannot be bipolar. But every instrument can be monopolar. bipolar seizures. Starr has made a bipolar seizures. Do you know how? One jaw is of metal, another jaw is of plastic, and only tip is metal. So there is a wire going from here, and it is not short-circuited. Just like Robbie dissector is a Maryland bipolar. So the joint is made up of plastic. But every instrument cannot be bipolar. You cannot attach the bipolar lead to a simple seizures or simple Maryland. Isn't it? Because by default, bipolar, both the jaw from the generator up to the machine should be separated, insulated. And only the tip should be naked where the current travels in between the jaw. In bipolar, there is no need of patient return plate, there is no need of removing the ornaments, there is no need of putting the insulation over the table, because there is no patient return plate. One is active electrode, other is return electrode. An active electrode current will go, and current only travels in between the jaw and then it returns back. So most of the time, for almost all the gynecological surgery, only bipolar is recommended. If you are using monopolar, that means accident is waiting to happen anytime. Now, waveforms. What are the waveforms which is used in electrosurgery? If you are okay, then it is okay. Otherwise, I can give you a 2-minute break. If you are fine, then it is fine. Because still half of the lecture is there.
2 minutes break.
2 minutes break? Okay, so I will give you, because already 1 hour, so I am giving you 2 minutes break. Now, the waveform affecting the setting of the electrocautery. When we use electrosurgery, there are 3 types of waveform. One is pure cut, another is blend, and third is coagulation. When you use yellow panel, that means it is a pure cut. And when you press the yellow panel, your machine is giving 100% efficiency. Like suppose your machine was 500 kilohertz to 10 megahertz frequency. When you press the yellow panel, it is giving 10 megahertz frequency. That is 100% on. And due to that high frequency and due to that turbulence of ion inside the cell membrane will fracture, tissue will get evaporized, it will get exploded, and that is called cut. Because as soon as you touch the tissue evaporized. And the remaining tissue remains like this. Tissue is fractured, cytoplasm is brushed, and it cuts out. It gives you way. Just like knife. When you cut with the knife, the sharp edge of the knife, cell membrane cannot tolerate. Cell will get fractured, together with tissue get fractured, and that is called as cut. It is giving you way. Another is coagulation. Coagulation, you have to use the blue paddle. When you press coagulation paddle, voltage is high and frequency is extremely low. Only 6% of the time your machine is on. 94% of the time your machine is off. So, In cases of the coagulation, cell membrane cannot fracture. If you are using 500 kHz to 10 MHz frequency, that means blue pattern only 500 kHz comes. There is no turbulence, there is only movement. Turbulence word means uncontrolled movement that happens in cutting. In coagulation only 6% of the time frequency comes, 94% it doesn't come. So there is a little movement of the ion inside the cell which increases the temperature. Once temperature of the tissue comes at 55 degrees centigrade, then protein get denatured and then it shrinks. Once the denatured protein shrinks, lumen of the vessel get closed. Now the temperature further increases to 80 degrees centigrade. Then elastin and collagen of the lumen of the vessel will touch and it will seal. But you are over enthusiastic. Still cooking. Now temperature goes 100 and above. At 180 degrees centigrade, all the melted elastin and collagen burns. And once it burns, rebleeding starts. Most of the time, not achieving hemostasis during surgery is due to over-enthusiastic attempt and overcooking. Sometimes we are afraid of bleeder and we overcook. And we think that if I am overcooking, then it should not be any bleeding at all. But it is actually reverse. Most of the time, overcooking creates bleeding. Why? Once the elastin and collagen is burned, it behaves just like a burned ash tip of the cigarette, like a charcoal. And when you move, it slough out and rebleeding starts. And now you are in big trouble. Most of the expensive instruments like Ensil, Ligasure, Thunderbeat, Harmonic, all the PK energy, all are taking money from you. Do you know why? To keep the temperature up to 100 degrees centigrade. They take the money from you to make some computerized circuit so that temperature should not go more than 100. So why not ourselves we should keep in mind that our temperature should not go more than 100 degrees centigrade. And then you can achieve the better hemostasis. Some surgeons has a bad habit that they cut the muscle with the coagulation current. Doing laparotomy, they cut muscle rectus with the coagulation current. And they give this explanation that when I cut with the coagulation, I have less bleeding. And this is true also, they have less bleeding. But they don't understand one thing, that whenever you are cutting with the coagulation, the margins of your wound has the dead tissue, burned collagen, burned protein. And when you suture it, those burned dead margins will create more chances of infection. And many a time healing process is by secondary intention from the bottom. That's why there is a hypertrophic scar of the skin. And infection rate is more. If you will cut with by cutting current, the tissue which you have touched is vaporized. But the margins are completely healthy. And that's why healing is better. So never cut the muscle by coagulation current. If you want to do that, company has given you blend mode. In every machine there is a blend button. When you switch it to the blend, that is a mixture of the coagulation and cutting current. And in those situations, You will achieve little cutting also and little hemostasis also. Blend 1 means more nearer to cutting, and blend 3 means more nearer to the coagulation. Now cutting is of two types. What are the type of cutting? One is pure cut, another is blend cut. Where you will use pure cut? Suppose you are using colpotomy, you will use pure cut. But if you are using myomectomy to cut the muscle for intramural myoma, you should use blend. Otherwise it bleeds. If you have to separate the gallbladder from the liver, you will use pure cut. But if you are cutting the liver for the partial dissection, then you will use blend. So cutting is of two types. One is pure cut, other is blend cut. Exactly same way, coagulation is of two types. One is called as fulguration, other is called as desiccation. What is fulguration? Fulguration is coagulation current from some distance. This is also called as a spray mode. Sometimes what happens, we don't want deeper injury. We want just superficial spray. Just like if I have to paint my car, I will take one spray machine in my hand. And I should not touch the body of the car. If I will touch it, all the paint will drop down. I should maintain a distance so that a spray will go and thin layer of the paint will be all over. Exactly same way, in a spray mode, width of injury is 1/6 more, depth of injury is 1/6 less. And it is very good for endometriosis. Like you have endometrial spots around the uterosacral ligament. You will go with a spatula as you will spray and superficial burn. If you will try to hold it, then it is called as desiccation.
It's used in the liver tear
Yes,
as argon.
yes. It is sometime when you are, even if you are doing cholecystectomy, and if there is a lot of oozing from the liver, you can do fulguration, a spray, just so that a thin film of coagulum will form over the surface of the liver that will keep the bleeder behind. But if you don't do this, if you will go by Maryland and try to catch the bleeder, there will be more bleeding because you will enter into sinuses. Fulguration current is very good for the partial tear of the spleen, partial tear of kidney, partial nephrectomy, sometimes even after myomectomy, for the oozing bed, endometriosis, endometrioma, it is good. Wherever there is a generalized oozing, it is better. Now another is desiccation.
What is desiccation?
Desiccation word means coagulation current with firm contact. If you are holding by bipolar or monopolar any blood vessels, that is called as desiccation. In desiccation, width of injury and the depth of injury is equal. It is same. Depth of injury and width of injury in desiccation is same. Now one more problem of the bipolar. First problem of bipolar,
Doesn't cut.
nothing cut. Second problem of bipolar, every instrument cannot be bipolar. Third problem of the bipolar, for same wattage of the current, lateral spread of the heat may be little more unless until you keep the wattage less. Fourth problem of the bipolar, it doesn't fulgurate also. It only desiccates. Suppose you have an endometriosis with the bipolar two poles, you will go near the tissue tissue will not attract to the electron from bipolar. When you go with the monopolar, it attracts. Why? Body is attached with the potential plate. So due to that, tissue itself is one electrode. And one electrode is your instrument, long cylindrical instrument in the pneumoperitoneum cavity. In open surgery, you are not giving at that much blind cavity. So once it goes, it attracts and the spray works. Bipolar cannot fulgurate also. That's why even if the monopolar is risky, we cannot throw the monopolar from our OT. Suppose you have to do polycystic ovarian drilling. Bipolar cannot work. Suppose you have to do colpotomy. Bipolar is useless. Suppose you have to do the cutting the serous layer of the uterus for myomectomy. Bipolar is useless. So in all those situations, you have to use monopolar. And desiccation is the only thing which bipolar can give you. Whereas monopolar can give you cutting, it can give you blend, it can give you fulguration, and it can give you desiccation also. In desiccation word means desert. It came from desert word, bony dry, completely dry, desiccated. And in desiccation what happens? Tissue doesn't fracture. Water content of the cell will come out and the protein will get coagulated, it denatured, and the cell membrane shrinks. Then the lumen of the vessel come nearer to each other, elastin and collagen will melt and then it will be fused. This is a fused lumen and this is a proximal burned lumen. If you are good in electrosurgery, you know the art of electrosurgery, then you will fuse the lumen. Elastin and collagen is completely fused and this is permanent completely. But suppose you don't know how to fuse the lumen and you have applied more temperature like 180, 200, 300 degrees centigrade, then also bleeding stops. How bleeding stops? Because some of the blood clot which will burn, that will make the proximal thrombus and will plug into the vessel and bleeding stops. But this bleeding is stopped by the God. And if God is not happy with you, once you will cut it, this proximal thrombus may dislodge. Or later after surgery also, if little fluctuation in the blood pressure or movement or anything happens unwanted and this proximal thrombus is dislodged, rebleeding starts. So if you have only cooked the vessel and it is a fused lumen, then rebleeding will never start. Variables impacting the tissue effect. Why sometimes we have a good tissue effect and why sometimes we have a bad tissue effect. These are the variables. First is waveform. You should keep in mind that correct waveform should be used over the correct tissue. If you want to cut, if you want to blend, if you want to desiccate, if you want to fulgurate, in your machine, all the buttons are there. And you should select all the machine buttons, how buttons are there. I am going to demonstrate to you. And there is one practical also. In that practical you will do the different type of cutting and fulguration. And during the animal dissection also, you will do yourself. So machines are ladana. So this way, correct waveform has to be selected. Then second is power setting. Appropriate power setting should be used. And this you should know that which power setting is required for which surgery. Less power setting is also not good because outside it looks like cook and the current will not go inside. That's why heat is not going inside. Inside is uncooked, and after cutting the vessels, it bleeds. If it is more power setting, then also it is not good, because outside will burn and inside will be uncooked. Another is size of electrode. Whenever you want to cut anything, you should use the sharp electrodes. Just like when you do salpingotomy, you should use tritome or PC or needle. Sharper the instrument, better will be the cutting effect. And whenever you want to coagulate any instrument, you should use little blunt instrument. अभी वहीं छोड़ दो, फिर हम बुला लेंगे तुम लोगों को. Once I have to demonstrate it, then I will call. So this is important, that size of electrode should be proper. Suppose you have a ectopic pregnancy and you want conservative management. You don't want salpingectomy, you want salpingotomy. Then to cut the fallopian tube, which instrument you should use? Pardon? Sharp, tritome. Why? Because less wattage of the current you can cut. And if you use less wattage of the current, margins will be healthy. And if you suture, there will be better union. But suppose you are using the hook to cut the tube, it is not a good idea. Because if the surface area of your electrosurgical instrument is more, collateral injury is more, margins will be burned. And after cutting, if you want to approximate, it cannot fuse properly and there may be open tube. But if you want to do colpotomy, tritome is better or hook is better? Hook. Why? Because you want some hemostasis also. If you do colpotomy with the tritome, it will cut very nice, but it bleeds, isn't it? So you should use hook, so that little cutting and little coagulation effect also will come. So size of electrode matters. Another is time. Less than 1 second time is not good, more second, 3 second time is not good. I am not telling that cook only for 3 seconds. What I am telling you, in one go we should not go more than 3 seconds. Like tay, stop, tay, stop. In one go more than 3 seconds we should not do. Manipulation of electrode is extremely important. Whenever you want to coagulate any structure, you should release the tension. Do you know sometimes when you do hysterectomy, and when you are coagulating the uterine artery, don't ask your assistant to give you a lot of contralateral traction. Because during coagulation, it is the nature of every tissue wants to shrink. And you have to allow it to shrink. So that if it is loose, it is shrinking. Just like the rubber, when you burn, what it happens? Shrinks. The egg, when you coagulate, what happens? It shrinks. So once it shrinks, lumen of the vessel come nearer to each other and it fuses. And then inside the lumen, elastin and collagen will permanently seal it. But suppose your assistant is giving a lot of contralateral traction and you are cooking, and suppose this is a vessel and it is pulled like that. Now when you cook it, outside it becomes brown, but because of the over traction it could not seal it. And then when you will cut, bleeding starts. During coagulation, any vessel, cystic artery, uterine artery, splenic artery, any short gastric artery, during the sleeve gastrectomy and all, any traction over the vessels must be released. Then only you will get hemostasis. And whenever you want to cut, you must give the traction. Suppose this is a cloth, I will keep it loose in front of you like that. and I will give you a knife, can you cut it? Knife will slide over it, will never cut. But if I will hold it and I will stretch it like that in front of you, and then I will tell you cut. You will put the knife and it will cut completely. So cut, if you are separating the gallbladder from the liver, you should give anterolateral traction. If you are doing colpotomy, you are pushing colpotomizer. Why? Stretch. Then with less current you can cut. If you are doing posterior colpotomy, you are holding a sponge and pushing into the vagina, and then it cuts. So, how you manipulate it is important. Another is type of tissue. The tissue which has more water content, it needs less wattage of the current to cut. The tissue which has less water content, it needs more wattage to cut. Just like if you want to cut the fallopian tube, within 10 to 20 watts you can cut. But if you have myoma and if you want to cut it, you may need 80 to 100 watts. And if you want to cut a bone, you cannot cut it. With simple, because in bone water content is very less. And if it is a fat you want to cut, very less wattage you can cut. So water content type of tissue is important. Another variable is scar formation. After 2, 3, 4, 5 minutes time, the burnt tissue gets deposited over the margins of your instrument, in between the jaw. That creates like a insulation. And that will affect your effect. You are holding the tissue, but it doesn't coagulate. Just like when your servant is making the food, and if all your vessels inside is black, that means she has burned a lot of things. And next day it has to rub a lot to clean it. So making a lot of a scar, that means you are not a good cook. If your instrument jaw is getting black scar formation, that means your intensity of the current is high. And that means you should decrease the intensity of the current. You are not cooking, you are burning. But if a scar forms, take it out and put in a small ball of hydrogen peroxide. Immediately it becomes clean and your time of surgery will decrease. Because hydrogen peroxide.
It doesn't burn the patient, the hydrogen peroxide?
No. Just you put the jaw in the hydrogen peroxide outside, not inside. In the cup, yes. And then just clean it by the sponge and then you go and perform surgery. Your performance will improve. If you don't have, never mind, you can use normal saline also with a gauze piece to clean it. But don't use knife and all to clean it. That will spoil your instrument. So a scar is not good, a scar should be prevented. Now we will discuss some of the new generation equipment. One instrument is called as Argon Enhanced Electrosurgery. As we know, fulguration is very good. Why fulguration is good? Because it can spray the tissue without doing the deeper injury. But problem is it can only go up to 0.5 millimeter distance. So the scientists, they thought how to increase the capacity of fulguration, and then this argon beamer was invented. In argon beamer there is a tube outside which will blow the argon gas. And argon gas has a property that it is inert gas. It is non-combustible gas. This gas is easily ionized by radio frequency energy. It creates bridge between electrode and tissue. Means, if you are using argon beamer, it will take the current from the electrode and it will pass to the tissue without touching it. And then it is heavier than air, so it displaces nitrogen and oxygen. So what will be the effect? Less smoke, no odor, no contact is required You can do coagulation from distance also and reduce drag because gas cannot drag the tissue, no scar formation and less tissue damage. Argon beamer is especially very useful instrument for pre-sacral neurectomy or for bad endometrioma or for liver resection surgery. Where a lot of liver area is using, you can use argon beamer and it will increase your efficiency of fulguration. Next instrument is tripolar. What is?
Sorry, why, if it's so useful argon, why it is not?
Argon is why useful because argon is an ionizable gas.
Yeah, what I mean, why is not so common?
Because it only fulgurate. It cannot cut your uterine artery. Isn't it? It will burn the uterine artery. It cannot do the cutting effect. So fulguration wherever you want, then only it is useful for tripolar. Yeah. And then comes the tripolar. Tripolar word is not correct. This is wrong term. There is nothing like third pole in the world. But company has given the name tripolar. So this is a trade name. Actually, we know one of the limitations of the bipolar is it doesn't cut. So here it is a bipolar with a cutting blade. So your instrumentation time is decreased. Because otherwise you have to cook by the bipolar, bring the instrument out and bring the scissor to cut. Here there is a blade, you push it and cut it. This is a beautiful instrument which is used many times for different procedures. Just I will show you. It is used sometime in splenectomy, sometime in nephrectomy and the different other situations. If you see here, this is a splenectomy surgery. And here, this is a tripolar. You can see this is the splenic artery and splenic vein. And window has been made there, in between the vein and artery. And this is a tripolar instrument. You can go, you can cook it intermittently. Artery has to be taken first, that's why. And you hold it and open the jaw. Otherwise it will drag. Again go, again catch, open the jaw. Again catch. You are not allowed to cook it without changing the jaw. Otherwise it will get a stick. If you will not turn the omelette either side, it will stick. So intermittent activation. Again open the jaw and remove it. You see it is sticking. So not let it stick. Not let it burn. Color of the smoke is white, not black, and then cut it. This is a blade which has cut. Take the name of God and open the jaw. No blood. So this is tripolar. See here, this is the pole. This is the sharp knife which comes and cuts in between. This is tripolar. Here it comes.
We use it for ectopic.
You can use for disectomy also. You can use for appendicectomy for major appendix. You can use for colorectal. It can be used for many places. Then again for the vein and all. So this is a beautiful machine. But only problem of this machine is, this instrument is, that after couple of use, then it doesn't work. Why? Because blade becomes blunt. Then it doesn't cut, it starts dragging the tissue, pushing the tissue. So basically it is a disposable instrument, single use. But it can be used in any generator. It doesn't need ligacure and all. In any machine, even in 15,000 machine, it can work. Now comes the harmonic. Harmonic was invented. Actually, it is an ultrasound machine. One gynecologist, one day, she was doing the vaginal ultrasound. And patient was a little panicked probe was dropped, and then she tried to fix that piezoelectric crystal her own and tape it, and then next patient it burns. So she called the machine engineer that this is useless instrument, it is burning rather than giving ultrasound. Then they said that no, actually you have displaced the piezoelectric crystal. So you have to buy new. But what she did, that she attached one knife over the piezoelectric crystal and then it was cut in. Ethicon has given only $50,000 to that and bought this patent technology.
So the gynecologists, which country, sir?
Nothing, $50,000.
Which country
From which
gynecologist?
the
Belgium.
Belgium.
Yes. And now you will be surprised, they have made more than $50 trillion with selling these instruments. Almost all the hospitals they have now. It is a friction energy. It is not current. There is a principle of electrosurgery, a principle of piezoelectric crystal, that if you put the current there, it vibrates. Piezoelectric crystal vibrates. In your quartz watch also, there is piezoelectric crystal. This is tripolar. This is tripolar. If you will see here, there is a blade, and this is a knob here. You have to press, and blade comes out. So basically, this is bipolar. Open it, and there are two poles here. There are two poles only. You can attach one and second. This will go in the bipolar. These two, and this is just you hold the tissue. Cook it 3 times and then press it. That's all. It is cut. So no need of seizures to come. So uska transducer le aana, harmonic ka. So what is there? That it vibrates at 55,500 vibration. This is a piezoelectric crystal inside. नहीं पूरा उठा के ले लो. Piezoelectric crystal this side. And this piezoelectric crystal is just like the vaginal probe of ultrasound. Yes. Isn't it? If you remove this cup, there is a screw. And in this screw you can attach anything you want. Hook and the seal. Whatever you will attach here, it will vibrate linearly. And you can attach harmonic hook, harmonic knife, harmonic ace, harmonic shear, harmonic wave. There are many instruments. There are many instruments which can be attached there. And then you have the control over your finger. And you can work. You have the positive. This is the vibration. Do you know this vibration is visible? Just to show you. But in reality, it will not be visible. It vibrates. So, these are the hook, harmonic hook. You can attach it here, and then you can attach this, and then you can do cholecystectomy, you can do corpotomy, you can do any surgery, and it vibrates, tip vibrates. Then you can use harmonic ace. This is harmonic ace. Then you can use the different, even open surgery here, and it has two jaws. If you see, upper jaw has silicon. This is silicon, and actually lower jaw vibrates like that. You are seeing it, but here you cannot see. So you have to tighten it, and this is tightener. 1, 2. 2 clicks will be there, and now it is ready. One jaw is vibrating jaw, one jaw is silicon jaw. And this straight jaw, vibrating jaw vibrates at 55,500 vibrations per second. In the machine, if you will see here, there is a setting. This minimum setting can go from 1 to 5. If you will keep it to 1, that means vibration is 15,000 per second. 2 means 25,000, 3 means 35,000, 4 is 45,000 and 5 is 55,000. So if you have to coagulate more and cutting you should need slow, you will keep it to 1. And if you have to cut faster and you want less coagulation, you will keep to 5. You will use minimum and maximum. Do you know for harmonic, the term cutting and coagulation should not be used. Because cutting coagulation term is used for electrosurgical machinery. It is called minimum and maximum. If vibration is low, coagulation will be more. If vibration is fast, coagulation will be less and cutting will be fast. Am I clear? But harmonic always cut with coagulates. It is not like that it will coagulate and it will leave you. It cuts and coagulates together. And actually it vibrates. And I will show you how it vibrates and how it cuts and coagulates. And this way we will see it. So this is the minimum, this is similar concept, this is maximum, and in this transducer you will attach it, and after that here this is minimum, this is maximum. This is in your finger, and once you will touch it, it vibrates, and due to that vibration heat increases, and then it coagulates and it seals the vessel up to 5 mm. Vessel up to 5. These are different instruments. This is A, this is knife, this is hook, this is the different type of sharp. So different type of instruments are there. It can be used even in open surgery for vaginal part of hysterectomy. Tissue tension will be minimized, pressure can be minimized, power level you can adjust. And this way you can perform the surgery even for gynae procedure, for hysterectomy, for salpingectomy, even for salpingotomy, even for ovarian drilling. Do you know why? Because only one blade, vibrating blade you can use, and this vibrating blade can prick over the vessel and it can be performed. So suppose you have this is the setting, it can rotate also, and then suppose you have, this is the vibrating blade and this is silicone blade. This is silicone blade.
Silicone for sealing?
Silicone is just to bring the tissue near the vibrating blade. It is inert, it doesn't have any effect. And another advantage is it doesn't allow the vibration to go to the other jaw. So that it will be adaptive tissue control, means tissue will not get destroyed. According to the diameter of the tissue, it will transfer the energy. And this way, coagulation and cutting, you don't have to bring the seizures. Coagulation and cutting will be same time and it will make your surgery faster. You can see here the vibration goes and it seals the tissue and cut the tissue also. So this way this technology has removed almost all the complication of electrosurgery. Only problem, it is expensive. Cost of this probe is 35,000 rupees and it lasts only for 5 surgeries. Although it is disposable, ideally it should be 1 surgery. And the cost of machine will cost you approximately 15 lakh rupees. That is for your generator. Here you can see one single vibrating jaw. If you have to do salpingotomy or if you have to do side-to-side anastomosis of the bowel, you can pierce it and you can cut it. And this way it can work as a good dissector. Now we will see here that this is the here ठीक से लगाने हुआ है नीचे अंदर पूरा प्रेस करो. This sound means there is something wrong. Off करके on करो फिर. This is a error sound. Now again he is switching off and on. Remove the this standby and put it to the hand activation. Standby हटाओ and put to the hand activation. And now it is testing. This is chest angle. This sound means it is chest angle. Now see, I am pressing and you cannot see anything. Nothing happens. This sound means minimum. This sound means maximum. Frequency is high and this is minimum. And see, I am touching it. It is not completely cold. It doesn't burn. I use it and then I touch it. It is cold, completely cold. Now, you are not seeing anything. But when I will put it, see, it vibrates. It is vibrating. And if I will put to 5, it vibrates that much. And this is a vibration, linear vibration, which give you effect. It can seal the vessel up to 5 millimeter without burning. Why it is better than the monopolar bipolar?
No.
Because temperature cannot go beyond 100 degrees centigrade. Why? Because water temperature will not allow the friction energy to go within 100 degrees centigrade. Suppose you will rub 2 stones inside a river. You take 2 stones and just dress yourself with the scuba diving and go inside the bottom of the sea. Let me show you first the coagulation effect. Done. It is sealed. And now I will show you. She is putting the water inside. It will not leak. It is sealed. Done. See that? So this is the advantage of harmonic over the electrosurgery. Because why it happens? Because temperature is less. So I was talking about you take 2 stones and sit inside a river and keep on rubbing those stones. You will never get a fire. Because as long as there is water inside the river, it will never allow the heat in between 2 stones to go beyond 100. Isn't it? All the heat will be taken by water. Exactly same way, as long as tissue is live, and if you use harmonic, friction energy will never go more than 100. And at 55, protein coagulates, and at 80, elastin and collagen melts. And that's why it gives you better hemostasis.
So, if the diameter of the artery is more than 5,
then it is not good. Then you have to use any mechanical method like clip, like suture, like applicator, like that. अब उसमें इसको लगा दो, अब डायरेक्ट कपलिंग कैपेसिटिव कपलिंग बताना पड़ेगा उसके लिए, ट्यूब लाइट वगैरह ले आओ, इसको रखो. So we will have one hands-on for you in the harmonic also.
While using bipolar, our sister usually spray saline.
You know, putting a saline doesn't have any effect. It is why? Because they have got this apprehension with the thermocoagulation before. In the old time, there was electrocautery machine. As I was telling you, electrocautery machine was the heat application. So at that time, people were putting the saline.
Saline what?
That is the saline means the fluid, normal saline.
Over the tissue?
Over the tissue.
To cool the tissue?
Yes.
collateral damage will be less than?
No, by the time you put it already, whatever has happened, it is already happened. Now it is not going to be helpful.
So there is no use pouring saline while,
No.
while using bipolar?
No, it is absolutely useless, unnecessarily spending time. There is no need of putting any saline either before or at the end.
So, water is present even while we use bipolar.
नहीं उसको रहने दो एक ही तरह ना. Yes.
So water is present even while we use bipolar. Then why not water doesn't prevent it from?
Why? Because bipolar current, it is not due to the friction. It is due to the turbulence of ions. So by default itself temperature goes, it brushes to 300 degrees centigrade. Friction energy has limitations. Current is a spark. It doesn't have limitation. So that's why it goes. But of course, if you will keep the low intensity, if you will keep intermittent, then also you can achieve only 100 degrees centigrade in the even in bipolar or monopolar. That's why I am telling you, you should do this. Now this is silicon jaw, this is vibrating jaw. This silicon jaw, नहीं, capacitive coupling के लिए ट्यूब लाइट में लगा के नहीं लाते हैं. ट्यूब लाइट CFL बल्ब ले आओ ना. And if this vibrating jaw will directly touch any of the bowel or the vessel, it will bleed. So take care, always silicon jaw should be towards the sensitive area. Hook लगाओ, monopolar लगा दीजिए. Am I clear?
No.
Suppose this is a silicon jaw, this is a vibrating jaw.
Yeah.
Then always this vibrating jaw should be up, under your vision. Silicon jaw should be below. Because accidentally if this vibrating jaw will touch the bowel or touch any other vessel, it will puncture that bowel or vessel. This should be down because silicon jaw doesn't allow the vibration to get transferred. It is acting as a shock absorber. Now it's clear. So this small precaution should be taken whenever you are using harmonic. That the vibrating jaw should not touch. Again I will show you this video, then you will understand that this is vibrating jaw, this is silicon jaw. If any bowel is touching here, no problem. But if it will touch here, it will puncture because this is vibrating jaw. It will puncture. So always keep the silicon jaw towards the delicate area, vital area. And vibrating jaw should be visible. So that tip of the vibrating jaw should not touch any important structure. Otherwise it will puncture. So this is a small precaution should be kept in mind. Now comes the ligature. Ligature was actually, Valley Lab company is one of the best company in the world for the electrosurgical generator. Once upon a time, they have one conference, they ask the feedback for many surgeons that what is the problem you are facing most of the time in our machine. They say sometimes it is overcooking, sometimes burning, sometimes bleeding doesn't stop. Then they say that means you are overcooking, you are doing the wrong setting up or wrong paddle or the wrong timing. Then they say you are doctor or I am doctor, you are teaching me what is the timing and what is not. Then they say it is very difficult to teach the doctors. So let us teach our machine. And they remove all the buttons from their machine. There is no more setting left for the doctors. And this is called as tissue response electrosurgical generator. Tissue response means it can talk with the tissue. It can take the response from the tissue. And as soon as you will touch the tissue, it ting tong, stop.
Yeah.
That means it is good. So you have to press and wait. There is a collagen sensing capacity here, and as soon as it will, according to the diameter of the structure, it will decide the energy. So suppose that much thick pedicles is there and you will hold it like that, that means jaw is more open. And then automatically it will take the 120 watt.
But it takes time, yeah?
Yes,
More time.
it has to give, time is important. And then ting, ting, this sound down. And if you hold a very thin tissue, ting, 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 tong. Means if the jaw is less open, it will give more intermittent. And it will do immediately. If you hold a bunch of tissue, it takes time. So it has a confidence up to 7 mm, you can see.
What would happen if you grab a larger vessel, like 9 millimeters? Would
If-
it work?
9 mm. 9 mm is only aorta. I doubt that any 9 mm vessel generally you will not coagulate. But if you want, then you should not. You know, they are claiming 7 mm. But even 7 mm don't try ligation.
I mean, will the machine fire?
Yes,
It will, so if you...
it will fire.
So it's done in that way.
Yes, but maybe after cutting it bleeds.
So the machine's not that smart.
No, that's not that smart. It is claimed to be that much smart. But it is not that much smart, always you have little apprehension. That's why always for that much great vessels like the renal artery, splenic artery, better to use mechanical method rather than depending upon the energy. Mechanical method means either hemolock or the stapler endo-GIA or the vascular stapler or the suturing and then use it. So it has a bipolar and it has a cutting blade and it has a unique energy output and it minimizes the multiple applications. Now there is one problem. Problem is that harmonic is not a good, the bipolar, this ligation is not a good dissector. And harmonic is a very good dissector. But harmonic is not a good vessel sealer. Whereas ligation is a very good vessel sealer. So you might have seen this hysterectomy, we were using bipolar, not monopolar, bipolar and harmonic. This idea has been taken by many surgeons. They do this. And then ultimately there was one company, that is Olympus. They thought, oh, surgeons are very clever. They cook by bipolar and cut by harmonic. So that if bipolar has left something uncut, harmonic will again seal it. So they have invented Thunderbeat. Thunderbeat is a very good machine which has bipolar and harmonic both. So you know what it does? It cooks first with the bipolar technology and then cut with the harmonic. In this jaw, bipolar and harmonic both are there. One machine is bipolar, one machine is harmonic, and when you attach, supply goes to both. So it cooks first, and as soon as this machine will tell that my cooking is finished, then harmonic starts and ting, 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 it will cut also. So it has inbuilt bipolar together with the ultrasonic dissector. That is called as Thunderbeat. And this is more smart machine rather than the previous versions.
Reusable.
Yes. Now, safety consideration in minimal access surgery. Up to this point of the PowerPoint, whatever we were discussing is applicable to both open surgery as well as laparoscopy.
Suppose, as we discussed, it got up to like harmonic, up to 5 millimeter of artery or seals artery. Suppose a bunch of tissue surrounding the artery we are using harmonic, and is it like that it will only cut or coagulate 5 millimeter of the tissue and artery?
That is, if you want that effect, then you have to buy CUSA. That is cavitational ultrasound activated energy. That is used for liver resection. In that CUSA, what happens? It will only desiccate the liver tissue and will leave the vessel, and that vessel you can apply clips or stapler.
For example, uterine artery.
In uterine artery, you don't have to worry, it will seal the uterine artery as well as surrounding tissue and cut together.
Even if it is bunch of tissues.
Even if it is bunch of tissue. Anything comes in between the jaw, it will seal and cut. Harmonic you can use. But if you will compare the uterine artery with harmonic with ligacure, then ligacure is better. Ligacure is a vessel sealer. Harmonic is a dissector, remember it. Ligacure you can never ever use for ovarian drilling. Because it is a bipolar, isn't it? Harmonic, this vibrating jaw you can pierce and you can drill it. Ligacure you can never use it for salpingotomy. Or you cannot cut the uterus for myomectomy. It will be very difficult to use ligacure to separate the gallbladder from the liver.
What about colpotomy?
Colpotomy, some people, do you know what they do? They make a small window in the anterior colpotomy and then put one jaw inside, another jaw outside, and then cook and cut with the blade with the ligacure. But that is not good. But harmonic is a good dissector. It can do colpotomy, it can do salpingotomy, it can cut uterus. It can separate the gallbladder from the liver.
What about the rejectomy?
Sir, using,
Yes.
using only the
Vibrating jaw. Using only the vibrating jaw. Harmonic on hai?
For
Loud.
colpotomy, you have to take that jaw up, no?
No, just you keep on touching with the vibrating jaw. I will show you. I will show you how to do colpotomy. So, sir, ये दे देना. वो glass होता है ना, plastic वाला. Yes. See here.
With the vibrating.
So on nahi hai. So with the vibrating jaw, you pierce, with the vibrating jaw you perforate, with the vibrating jaw you dissect the liver from the gallbladder from the liver. Don't close it. So it is a dissector. But if you want the uterine artery, get it cooked by the harmonic, it cooks. It is not like that it doesn't cook, but it is less than the bipolar. So dissect like this is again an error. Okay, it is loose. That's why it was giving error sign. You might be seeing here that there is one instrument icon is formed there.
Yes, sir.
Can you see that? And it is saying that where it is loose. So you can, that is called as active electrode monitoring system. Switch off. I am coming to that point. Switch off करके on करो. So this is, suppose this is here and I want to do colpotomy. पानी का जरूरत नहीं था. Suppose this is the vagina here and I want to do colpotomy. Just I will take it and I will activate it. See, like this. This thing, yes. Now it is tested. See here it is perforated. And just I am cutting. I am rotating. It is done. It is cut. So tip is just if you do ovarian drilling, suppose this is ovary, drill it. It is drilling. Jaw is open and here drilling. Whatever you touch, it drills.
The tip does not remain hot.
No, it is cold. Little heat will be due to tissue. It is a friction energy. Because tissue will, of course, when you rub, even if you have two hands, little heat is produced. But it will always remain less than 100. It will not go more than 100. I cut entire these things, but you never saw any smoke.
No.
It is cutting just like how the carpenter cuts the wood with the saw, isn't it? And that way it is a dissector. But sometimes before achieving proper sealing effect, it also cuts. So that's why vessel sealing capacity of harmonic is less than the light action. And in Thunderbeat, you have the advantage of both. Harmonic. Both is together.
The price of Thunderbeat more than both companies?
Yes. Of course. It is approximately 20. So, now I will discuss some of the safety consideration in minimal accessory. One is overshooting. What is overshooting? That never happens in open surgery. Overshooting means tip of the instrument going beyond the field of vision. This is overshooting. It is going beyond the field of vision. Another is overcooking. In laparoscopic surgery, over image. It's not as in surgery in reality. So sometimes you overcook. Isn't it? And if you are overcooking, you will have more bleeding. Then comes direct coupling. You should never bring any uninsulated instrument nearby. Suppose you are using hook. And if there is any suction irrigation. If you have a suction irrigation, if you have a telescope, if you have a cannula, if you have a knot pusher, if you have a needle holder, then immediately current will go to that and it will burn. Even if your cannula is very near to the target of dissection and tip of your Maryland is touching the tip of the cannula, it can take the current to the cannula and it can burn the water. Just like when one person is getting the current and with the bare foot, if you will try to catch that person, you are also getting shocked. Isn't it? In the movie they exploit this a lot in the comedy and all. So what you should do, you should go with the wood or to hit him to remove it. Otherwise it is called as direct coupling. So current of one instrument goes to the another and it burns the bowel. Sometimes suppose this is hook, accidentally it has touched the telescope. Then telescope will get the direct coupling. And telescope is touching the bowel and bowel burns. Like here, this is telescope is getting direct coupling and these oranges are burning. This is direct coupling. Another drawback is insulation failure. Insulation failure. Insulation failure is a big problem. Like suppose this is a tissue here, and suppose I am performing surgery, and this instrument I have not seen properly, and and suppose I am performing surgery, and accidentally it has touched somewhere. See, it is burning here. This is burning. I am doing surgery and this is touching somewhere, and it burns. Anywhere, where the insulation is failure. And this is a big problem happening in the many times during the laparoscopic procedure. You can see, although it is very invisible, press karo, and it burns. Can you see the burning? Yeah. It is burning. Now what to do? I cannot see this. It is very small. If you want to prevent the burning, this is burning here. Insulation must be checked very carefully. If your instrument is not checked, it is dangerous. Now there is two ways of prevent the complication of the burning. One way is you should buy this is the burning by insulation failure. Scissors working here and burning there. Here it is, insulation is reached and this cannula also get touched and now this transverse colon is burning. Now how to prevent it? If you prevent it, there are two ways. One way, if you are rich, then you should buy. There is one equipment that is called as active electrode monitoring system. This is active electrode monitoring system. You can buy this. There are a lot of companies which is making these equipments. Active electrode monitoring system has the advantage that if there is insulation failure or if there is a direct coupling or capacitive coupling, it writes you, it gives you alarm, please remove the instrument number 5 on the cannula number 6, insulation is failed. Otherwise, you have to inspect it yourself carefully. And remember, hook, look and cook. If you want to prevent the injury with a small insulation failure, hook, look and cook. You know, sometimes what we do, we are activating our electrode in open circuit. Like suppose I have to cook it. First I will press the pedal, and then you go. And then you go. It is extremely dangerous. Because a fraction of second which you taken the time to reach the tissue, in this insulation failure, current will jump even in 1 to 2 centimeters and jump like that, it will burn. But if already you will hook it, current will not go through the small insulation failure. So never activate your instrument in open circuit. First you hook, then look, then cook. First you hook, after hooking what you see? You have to see 4 things. First, amount of tissue which you are hooking. Amount of tissue which you are hooking should be less at one time. It should not be a bunch of tissue. Second, direction of the hook should be towards the anterior abdominal wall. It should not be superior or inferior. If you are a surgeon and superiorly if you are hooking, it will overshoot and burn the diaphragm. Or inferiorly it will perforate the duodenum or bowel. If you are a gynecologist, it will perforate the bladder or perforate the sigmoid. So always hook it towards the anterior abdominal wall. So I am hooking, then it will, even it will touch where? It will touch, burn the peritoneum. Third thing what you should look, traction which you are giving. If you are coagulating, release the traction. If you have to cut, increase the traction. And fourth thing, which pedal you have to press. So always hook, look and then cook. Then your problem of the electrosurgery can be minimized. Never activate it in the open circuit. And these type of insulation failure should be regularly checked. Now, capacitive coupling. What is this capacitive coupling? Capacitive coupling reducer है क्या? एक reducer with the plastic cannula with the metal reducer. Here is the plastic cannula with the metal reducer, and it becomes capacitor. This is a plastic cannula, and inside there is a metal reducer. This is a metal reducer with the plastic cannula, and I am putting an instrument there, tube light, and press karo. See it, press karo. And this, see the tube light here. I will show you. Current aa raha hai. See, this tube light is glowing. Did you see that?
Oh yeah.
How? There is no current here.
So how?
And close. This is called as capacitive coupling. Capacitive coupling. Press karo. Press karo. Press karo. This was a capacitive coupling only, which has burned me. Press karo. This is capacitive coupling. You know why it happened? Because as soon as there is a metal inside and surrounded by the plastic outside, this will give you the capacitor-like effect. What is capacitor? Capacitor is used in all the electronic devices to store the current for some time, isn't it? And in those situations, it is a cylinder basically. And any cylinder, if your current is flowing through inside the cylinder, surface of the cylinder stores the electrostatic current. And if that current, if it is completely metal, then that current is transferred to the abdominal wall and returned to the Pacemaker plate. If it is completely plastic, then also no problem. Plastic cannot store the charge. But sometimes inside metal, outside plastic. And inside metal becomes charged by electrostatic current, and that was blowing that tube light. And it can burn. After a few minutes, it will be charged and it will burn the bowel. That is called as capacitive coupling. That happens if you will put a metal cannula in a metal reducer in a plastic cannula. This is a metal reducer and plastic cannula. Now the current which is capacitor like stored in this metal reducer cannot be transferred to the abdominal wall due to this plastic cannula. And once it will keep on depositing, then it will immediately fire. And here you can see that's why this tube light was lighting there.
Sir, why tube light?
Because of the electrostatic current here. See there, this is burning. This is capacitive coupling. And this capacitive coupling is one of the big problems in the electrosurgery.
It develops if only there is insulating failure, or?
No, insulation failure is not required. Completely new instrument. Just like in the summer season when you comb your hair, you are getting a spark. That is electrostatic current. Sometimes some people when they open their car, they get current. Or touch the handle, they get current.
So the cannula was touching the tube light.
Yes, every electrosurgical instrument radiates the electromagnetic electrostatic waves. But if your reducer is of metal, it will store, it will reserve that current as a capacitor.
So this only happens with a plastic cannula?
Yes, if only happen if the plastic cannula is mixed with the metal reducer. If it is pure plastic, no problem. If it is pure metal, no problem. Because in metal, all the stored charge every time is passed through the abdominal wall. So it is not getting stored. Is it clear?
So in your experiment, the outside plastics and the reducer was touching the tube light.
Yes.
So the plastic is preventing the discharge through the abdominal wall.
Yes. So here you can see this is completely metal, no problem. But here inside metal, outside plastic. If it is completely metal, current is going where? Abdominal wall. It doesn't accumulate. But if it is outside plastic, inside metal will accumulate, and if it is a lot of charge, it sparks and it burns the bowel.
Disposable things are having this plastic cannula.
Yes.
So we have to be a bit careful.
Careful. Yes. Initially in the past it was happening a lot. Because company themselves they were mixing plastic with the metal. But now all the companies are knowing this capacitive coupling, so they don't mix metal with the plastic. But sometimes we ourselves mix the metal with the plastic.
How?
By using the metal reducer or plastic cannula, or sometimes different combination of the instrument can create these problems.
What happened when the gloves of the surgeon get bent?
That is, if gloves, if your hand is wet or gloves is broken, you can also get current because you will be a part of circuit, especially with the monopolar. Now,
metal cannula possible is
no problem. Now, if metal is touching in the abdominal wall, then no problem. Now, some risk to the pacemaker. So, if the patient has pacemaker, use harmonic. Don't use the current because programming of the pacemaker may change. Although nowadays, even the pacemaker design company, they know their circuit is very protected, but then also as a surgeon, this is our duty not to give any electrosurgical impulses in the pacemaker. Some risk to you is also there, because it has a viral DNA, bacteria, carcinogenic irritant coming from the smoke. So at end of the surgery, whatever a smoke is coming out, it has to be sucked out. Sucked out, otherwise, if suppose you are opening one of the valve of the cannula and suddenly it hit your nose and you are inhaling, all those carcinogenic, we will be harming ourselves. So ideally it should be sucked out or open towards your nuts. Don't open towards you. So this way you should avoid direct, because it is compressed. In open surgery, what it comes out, it keep on diffusing. Here interior milieu is maintained. So all the fluid, fractured cells, tissue, cytoplasm, blood, everything is compressed, and suddenly it opens and it blows your nose. Especially mask and all is not correct. There is a study in which comparison of laser and ESU means electrosurgical unit, has been done. Laser is more carcinogenic than the electrosurgical unit, but this also has carcinogenic. Patient, it doesn't have problem. Patient is exposed one time, but we are exposing ourselves every day. So we should avoid.
Is it fiction, sir?
Pardon?
Smoke contains viral DNA. Is it a fiction?
Yes, because of the fluid of the tissue. If the patient has some...
And if you wear the mask, it does protect?
Yes, it protects. If you will not put the mask here, the mask is not good. So it will not protect, otherwise it will protect.
And the percentage of getting infection?
You know, exact very big study has not been done that how much percentage or HIV or hepatitis. Generally it doesn't happen. But most of the time patient gets sinusitis, allergic reaction, and maybe in long duration carcinogenic effect has been proved. But how much incidence is there, that still we have to do some research on that, some review if we will do, we can find it out. So we are in the risk, and that risk should be minimized. Now this is the final presentation, final slide of this. This is the summary. Summary means inspect the installation carefully. Just make it a rule that if you have a hook, first you see and then go. Use lowest possible power setting. Use low voltage more, that is cutting is more. Cutting has less tissue necrosis. Use brief intermittent versus prolonged activation. Never press your paddle in one go more than 3 seconds. You can give 2, 3, 4 times, but intermittent. Do not activate in open circuit. Hook, look and then cook. Never activate your paddle if your tip of the instrument is not touching the tissue. Do not activate in close proximity or direct contact with the other instrument to prevent direct coupling. Use bipolar whenever appropriate. Whenever it is possible, always bipolar. Monopolar should only be used where bipolar cannot work. Like cutting, like fulguration. But wherever you have to desiccation, use bipolar. Select an all-metal cannula system as the safest choice. Do not use hybrid cannula system that mix metal with the plastic to prevent the capacitive coupling. Utilize the available technology such as tissue response generator to reduce capacitive coupling or active electrode monitoring system to eliminate the concern about the insulation failure and capacitive coupling.